Hello, my name is Dr. Dewan S. Raja. Today I will discuss about mucormycosis. Mucormycosis, old name is Zygomycosis, is an opportunistic infection, often fulminant infection, caused by bread mold fungi belonging to the families Mucormycetes. It is widely distributed in the nature and infects the immunocompromised people. People with immunosuppression has the chance to get mucormycosis. The major predisposing factor are neutropenia, that is lack of number of white blood cells in the blood, uncontrolled diabetes, mellitus, steroid use, iron overload, growth of the fungus is enhanced by iron. This is seen in a patient with thalassemia who are taking the iron chelating agent like that of deferoxamine. They have chance to get mucormycosis. Also in uncontrolled diabetes due to diabetic ketoacidosis, there will be more iron level in the body so that the chance of getting more mucormycosis. The growth of this fungus is enhanced by iron. Breakdown of cutaneous barrier, wound, burn, and trauma. Trauma means any trauma. Even it is found that in 2011 there is a tornado and the sharp debris penetration to the skin causes cutaneous form of mucormycosis. Mucormycosis affects the immunocompromised patient as well as including bone marrow transplant, patients with AIDS and leukemia. And also in an Indian study it is found that mucormycosis is also common to a patient who has suffered from COVID-19, who are diabetic, and the person who took the face mask repeatedly, same face mask by several people, they had more chance to get mucormycosis, especially those COVID patients over the age of 65 who are diabetic and who did not mention the did not use the proper masking. There may be cutaneous infection due to contaminated bandage or plaster in a hospital setting. Clinical and radiographic features. Mucormycosis has three common forms: rhinocerebral, that involve the nose, especially maxillary sinus, palate, orbit, may go to the brain, it may involve the meninges. Pulmonary involves the lung, and cutaneous. Common presentation are nasal obstruction, bleeding from the nose, that is epistaxis, facial pain, headache, facial swelling or cellulitis, diplopia. There may be swelling around the eye. There will be involvement of the cranial nerve, visual disturbance, and proptosis. Eyeball may come out feature. If the maxillary sinus is involved, there will be intraoral swelling, ulceration, necrosis. Necrosed tissue may become black of the gum and alveolar process of the maxilla or the mandible, usually maxilla, perforation of the palate. The surface of the tissue becomes black with massive tissue destruction due to necrosis. Lung involvement exhibit hemorrhagic pneumonia, multiple thrombi, and peripheral pulmonary infarction. Skin involvement may make a lot of ecchymosis and skin nodules. Okay, so now here, this is the Rhizopus species showing sporangium and rhizoids. So this is containing spore. These are the hypha. They are often non-septate. They have no septum. Most cases maybe a few septum. And this is the source of spore. Okay. And hypha are branching almost like that of 90-degree angle, like this. This is the CT scan of the maxillary sinus. It shows opacity here due to the involvement of the maxillary sinus due to mucormycosis. Okay. Laboratory diagnosis, direct microscopic examination from the tissue. Histopathological study, culture. Sometimes culture may be negative, so we must do all. Treatment by amphotericin B, which is a very potent antifungal medication. So amphotericin B, a potent antifungal medication. This is the medication of choice. Surgical debridement, immune reconstitution if possible, strict glycemic control in a diabetic patient, administration of antibiotic. Okay. So we got mucormycosis, 10 dark brown lesion involving the palate and patient with diabetes. Culture established, diagnosis of mucormycosis, serial fungal infection may occur. Okay. Treatment include control of diabetes, strict control, glycemic control, surgical excision, and administration of antibiotic if there is added secondary infection. Okay, and certainly potent antifungal like amphotericin B, like lipophilic amphotericin B. Here, another patient, involvement of the maxillary sinus tissue is necrosed, and there will be damage to the alveolar process of the maxilla. Okay, this is a patient with uncontrolled diabetes that may happen. Okay, here mucormycosis caused by soft and hard tissue destruction in a 9-year-old patient with acute myelogenous leukemia. Yes, in leukemia we have a lot of leukocyte, but the leukocytes are not mature and they are not able to phagocytose they have lost the normal function. They cannot phagocytose usually. Okay, so in case of leukemia, there will be immunocompromised condition and will get hard and soft tissue destruction. This is an involvement of the maxillary sinus and nose, and there may be involvement of the soft palate and hard palate. In this patient, due to extensive necrosis, here necrosis and tissue destruction happens in case of mucormycosis. And that's all about the mucormycosis. We have to remember that predisposing factors are many, like the neutropenia, although in case of leukemia we have a lot of leukocytes, but they are not normal, they are immature. So there will be chance of mucormycosis, getting steroid, having organ transplant, taking anti-cancer drug, having any other cancer that may lead to autoimmune suppression, that may lead to a problem of immunosuppression, and that may lead to mucormycosis. And that's all for today. If you have any question, please feel free to ask me questions. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and great day. Bye now.